Welcome to the Making the Most of Your Healthcare Experience workshop. My name is Jem Lee Herder. I am a trained and registered social worker and health education specialist at the Toronto Western Family Health Team. Today, we will discuss how to manage and make decisions about your healthcare, what to do before, during, and after you meet with your healthcare provider, how to manage medications, and finding reliable health information and community resources. I will discuss these points in general for your healthcare experience, but also in the specific context of our clinic, so you can learn how to fully benefit from being our patient at the Toronto Western Family Health Team. When you hear the words My Healthcare, what comes to your mind? What does it look like? Who are the people involved in your healthcare? Some might think of a system, buildings, and healthcare professionals. And it's true, it is a system. There are buildings, equipment, healthcare professionals involved in healthcare. But I want you to consider something important as you listen to the workshop today if you haven't already. To have the best healthcare experience, we need to have an active partnership and teamwork. I will discuss what I mean by that for the next few minutes. Did you know that we are more than just the family doctor's office? These are some of the team members in our family health team. From receptionists you come in contact with when you first call or visit us, to doctors, nurses, dietitian, pharmacist, social worker, physiotherapist, occupational therapist, respiratory therapist, and chiropodist. We all work as a team and actively communicate and collaborate to care for your needs together in a holistic manner. Please visit our website or speak to your doctor if you want to learn more about how to get support from other healthcare professionals in our team. Who else can you think of that are in your healthcare team? We also consider your trusted family and friends as part of our healthcare team. You can bring them to the appointments and give us their contact information so that we can have them on file to support you. Traditionally speaking, we think doctors or other healthcare professionals have all the answers and their opinion is the most important. But the truth is, you are the most important person responsible for your own healthcare. Think of the amount of time you spend with a healthcare provider compared to how much time you're spending managing your own health. For example, your doctor does not know how you feel each morning after starting on a new medication, or that you skip breakfast unless you share the information. Even if you forget everything we discussed today, I want you to remember these two things and take them home with you. The first thing I want you to remember is that you are the most important person for your healthcare. The second is that it's about partnership and teamwork between you, your healthcare providers, and your family and friends who support you. Have you ever seen this document around the hospital? This is UHN Partnership Agreement, Patient Bill of Rights and Responsibilities. The principles in the document apply to anyone working in partnership with their healthcare providers in general. You can search UHN Patient Bill of Rights and Responsibilities on internet and find it easily. I highly recommend that you look it up. To highlight some of the points in the document, it says you have rights as well as responsibilities to take part in your treatment plan, discharge planning, and transferring to another facility by giving input as best as you can. You also have the rights and responsibilities to accept, ask for, or refuse treatment. The partnership and teamwork for your healthcare should continue until the end of life. We don't like to think about how we or people we love will die someday. It's even more difficult to think or talk about it when you or the people you love have serious health conditions that can lead to death. However, dying well is an important part of your healthcare journey. That's why it is important that we start discussions about how you want to be treated and cared for the end of your life, while you're still young and healthy. So it's important that you discuss wishes for end-of-life care and make a plan. You can also give power of attorney documentation to your healthcare team in case you cannot make treatment decisions for yourself. I want you to know that end-of-life care plan is really about a continuing conversation you have with your loved ones, and not a black and white decision you put on a piece of paper. Are you familiar with patient portals? Most hospitals today have patient portals you can sign up for. It is a great way to actively be in charge of your healthcare because it allows you to see your appointments and receive appointment reminders. You can see your lab results or reports and find links to education resources, medical dictionaries, and other helpful websites. You can even choose to share your health information with others. The one we use at UHN is called MyUHN. I highly recommend that you go to myuhn.ca to find out how to register. While you can view all the information from UHN hospitals and beyond on MyUHN, please note that our clinic appointments and reminders are not available through this portal at this moment. Another way to actively be involved in your healthcare at our clinic is through email communication. If you share your email address and sign the consent form, we'll send you the appointment reminders, specialist appointment information, blood work and diagnostic testing requisitions, test results, and follow-up instructions from your doctor. We can also send some records through email when you request them. Did you also know that we send out newsletters highlighting the programs and services we offer, health information, and other news we have to share? If you're unsure if you have your email address and consent on file, please check with the reception. Now let's talk about some things you can do to prepare before you go for an appointment. First, make a list of your questions and concerns. Write them down in the order of importance and urgency. So even if you don't have the time to discuss all the questions, you will be able to address the most important and urgent issues. Have your family and personal health history ready. Maybe this is the first time you're seeing a particular healthcare provider and need to share all the information. Maybe you have been seeing the same family doctor for a few years, but just found out that your sister or brother has a new condition. You want to inform your doctor so they can keep your record up to date. Bring all your medications or a list of your medications to your appointment. This includes not just prescription medications, but also over-the-counter medications, herbal, and vitamins. Keep a health diary. Record information such as your symptoms, medications, medication side effects, blood pressure levels, surgeries, and family history. One patient shared with me how keeping a health diary helped her and her doctor to make a good care decision. Whenever she was at the clinic checking the blood pressure, she felt nervous, and it naturally made her blood pressure level go up. She monitored her blood pressure at home and recorded it daily. This gave the doctor a clearer picture of what her regular blood pressure was, and she could get the correct amount of medication she needed. If she didn't keep a diary and relied on the information, the doctor might have prescribed her more medication than she needed in reality. Ask a trusted family or friends to go with you to the appointment. They might help you remember things you forget to mention to the doctor or share their observation that can be helpful. They can also help you remember what to discuss during the appointment when you come back home. Make sure you know the location, date, and time of your appointment. If you have a virtual appointment, confirm if it will be through video or phone. If it is a video appointment, make sure you know how to set it up and have all the equipment and software you need. You can ask the receptionist how long your appointment is so you can mentally prepare for the amount of time you will have with the healthcare provider. Sometimes they will ask to confirm your appointment. Don't forget to confirm and lose your spot. Hospitals can be very difficult places to navigate. Take a look at the map or ask the reception for the instructions on how to get to where you have to be. You can also arrive early and ask the information desk. Now, here are some things you can do during your appointment. If they don't tell you or you forget, don't be afraid to ask them for their names and what their roles are. Honestly and confidently share your concerns and your personal health information. Remember that this meeting is about your health, and they are there to help you to be healthy. Not sharing important information truthfully can cost your health. It's just not worth it. Also, don't be afraid to ask questions you have. You need to know as much about your condition and health issues to make the best decisions for your health. Ask about what your exact diagnosis is, how severe it is, what the measures of the disease state are. And get the information and education you need to make informed decisions in a language you understand. These are 3 good questions you want to ask during the meeting. What is my main problem? What do I need to do? Why is it important that I do this? Also, make sure you clarify when you don't fully understand something. Don't say you understand if you don't. You can use these phrases to help make sure you understand. Let me repeat what you said to see if I understand this correctly. Let me show you how I'm going to use my puffer when I get home to make sure I'm doing it right. We discussed a lot today. Can you review the most important things I need to remember? Now let's talk about medications. Do you know about every medication you're taking and why you need it? Surprisingly, many of us don't always know what medications we're taking and what they all do. I've heard many stories from patients who took the medication incorrectly as well, which cost them their health. These are 5 important questions you need to ask about your medication. Ask about what you can expect the medications to do for your disease and what role do your medication play in the overall picture of the disease. So, what is the medication? Why do I need it? What is the dose? How do I take it and when? What are the side effects? Can I take it with other medications? It's also a very good idea to ask for this information in writing. As I mentioned, we have a pharmacist in our team you can meet with. You can also speak with the pharmacist at the pharmacy you go to. Pharmacists can help you better understand your medications, such as how they work, how to best take them, what they might interact with, and what are their adverse effects. Pharmacists can also help your doctors choose the best medications for you, help identify issues with your health, advocate for your care, and can help the way you take your medication simpler. They can also help you choose the most cost-effective medications. If you have a side effect, talk to your pharmacist or doctor about it. You might be able to manage it by taking it differently, changing the dose, or substituting it. Remember that you may not feel the benefits of a medication, but feel its side effects. Now, what can you do after the appointment? Medication adherence means how closely someone follows medication instructions and advice. This is a data from developed countries, and it says 50% of people who have chronic diseases do not do a good job of adhering to their treatments. I think we can do better. So what could be the reason that someone is not taking their medications as prescribed? Sometimes it's too complicated to follow the schedule or instruction. Maybe some people are taking several medications, not understanding how to take their medications correctly. Or it could be because the medication costs too much and they can't afford it. Also, having side effects might make them hesitate to take the medication as prescribed. So how do you get the most of your medications? Make sure you understand the instructions from your doctor. Ask your doctor or pharmacist to tell you what's on your prescription and about the side effects and drug interactions. At the pharmacy, make sure all the instructions are clear to you. And ask about side effects and interactions again. These are some good questions to ask to understand your medication instructions. What is the dose? Is this a number of tablets? What strength are the tablets? What is the total amount? How many times a day will I have to take the medication? Does it matter what time of the day I take the medication? Do I have to take the medication by mouth or another way? If you're not familiar with the way you're supposed to take it, ask them to show you how it's done. What important information do I need to know when taking the medication? You can ask about the warning stickers and food and alcohol. Remembering to take your medications can be hard. Some tips to help you remember are keeping them somewhere visible, taking them at the same time every day, setting a reminder on your phone or alarm, or using a pill organizer. There are many different forms of medications. There are inhalers, insulin pens, eye drops. You might have to clean some devices and store them in certain places. But whatever it is, it's important that you follow the instructions carefully. It's also a great idea to get all your medications from one pharmacy, so there is no confusion and your medications are organized. Here are some do's and don'ts of medications. Do carry a medication list with all your prescriptions, over-the-counter medicines, vitamins, and supplements. Be honest when talking to your healthcare providers about your medications and how you're taking them. Discuss side effects and issues when you experience them. But don't change the dosing or timing of when you take your medications without talking to your doctor first. Don't share medications with others. And don't take leftover medications or prescriptions from other sources. Now, let's talk about finding reliable health information and community resources. Libraries are great places to find reliable health information. Most hospitals have libraries dedicated to housing health information, books, audiobooks, and ebooks. And UHN has one in each hospital as well. Librarians are very helpful and skilled at finding specific health information you might be looking for. You can also access their online catalog. Toronto Public Library houses a large on- and offline catalog of health information and books. Libraries host many events to inform you about health topics with subject matter experts, and UHN libraries host a monthly talk covering different popular health topics by expert healthcare professionals and patient partners. You can find all the information from their websites and sign up for their newsletters as well. How to Partner in Your Care and Stay Safe is a small booklet you can access from the patient library online as well as offline. It summarizes many topics we discussed today. Where else can we find health information? Have you ever gone to Dr. Google? I'm sure you all have searched on the internet for certain health conditions or symptoms you have experienced. While it's great that we have access to so much information on the internet, it's sometimes hard to discern what's really reliable information on the internet and what isn't. In most cases, you can trust the websites from the hospitals, universities, government agencies, and national organizations. Some examples of these reliable websites in Canada are UHN's Patient Education Program, Health Canada, Ontario Ministry of Health and Long-Term Care. Some reliable websites we recommend from the US are Medline Plus, National Institutes of Health, and Mayo Clinic. So how can I tell if a website is reliable? The name of the organization is easy to find. It is clear to you who owns or hosts the information in the website. The owner or host is linked to a government organization, university, hospital, or well-known society. For example, Canadian Cancer Society, Arthritis Society, and Heart and Stroke Foundation. And contact information is available. You can find a phone number, email address, and/or mailing address on the site if you want to contact the owners for more information or provide feedback. The author or editors of the information are qualified healthcare professionals. You can easily find the name, education, and experience of the person who wrote or edited the information. An editorial board has reviewed the information. The information is up to date and based on scientific evidence, not just opinion. The website has a disclaimer. You can easily find a disclaimer that explains that the website is for information only and should not replace seeing your healthcare provider. The website considers your privacy. The website has a privacy policy that explains how it uses your personal information before you choose to provide it. The website is up to date and updated often. There is a date at the bottom of the page or article when the information was written or last reviewed and updated. The website includes an advertising policy. You can find a policy to help to tell the difference between what information is edited properly and what is advertising. This policy also explains who pays for the information on the website. And last but not the least, the website is easy to use. You are able to find information and move through the website easily. Avoid websites that are talking about miracle cures or trying to sell you a health-related product. If it seems too good to be true, it probably is. Avoid websites that have advertisements or that are asking you to pay to create an account or to see their information. Also, avoid websites that do not provide clear author information, date the website was created or updated, and any contact details or a privacy policy. Forums or discussion groups are maybe good places to share your personal journey and find the support of others. But they are not usually run by medical professionals. Discuss any advice or information you find on web forums with your healthcare provider. Having access to the right community resources is also important for our health. Some community resources I would like to recommend are selfmanagementontario.ca, 211 Ontario, thehealthline.ca, iamsick.ca, settlement.org, or local libraries. Have you ever explored our clinic website lately? You'll find information about who we are, what's new at the clinic, how to register as a new patient, our hours, programs and services, and health information and community resources. Our clinic website address is twfht.ca. As you can see, we offer multiple group programs and services for specific populations. Please take a look at our program page to find out what program might be good for you to attend. We also have resources for different health topics and community resources we update regularly. For example, this is the page of resources for mental health. And this is the page about the resources for sleeping well. We discussed briefly about healthcare for end-of-life care. The Advanced Care Planning page has the resources to think about end-of-life care and how you can start the conversation with your loved ones, as well as the documents you need. So to summarize what we discussed today, remember that you are the most important partner in your healthcare. And a great healthcare experience happens when you engage in an active partnership with your healthcare team. Communicate, ask, clarify, and follow the instructions, and repeat. Research reliable health information and access community resources. Thank you for joining the Making the Most of Your Healthcare Experience workshop. I trust that you found useful information and have new ideas and tools to be in charge of your healthcare journey. Please don't forget to fill out the survey to let us know how attending the workshop was beneficial for you and provide feedback. Take good care.